Hey guys, Ralph Havens here, Beyond Limits Physical Therapy in beautiful Fairhaven, Washington, Bellingham, Washington. This is the video with a bunch of self-treatment techniques for runners and active people, and we're going to get right to it. The way it works is called strain counterstrain, and what it means is we're putting pressure in a certain direction on different areas, bones, joints, ligaments, tendons, to take the pressure off of them. When we take the pressure off of them for a period of time, I'm going to say 90 seconds. Some of them are 60 seconds, some of them are 90 seconds. We'll go 90 seconds for all of them just to make it real simple. When you take the pressure off of them for a while, there's a little reflex loop that goes between the muscle, say the quadriceps or the hamstring, to the spinal cord, and the spinal cord reads everything as very safe because you've taken the pressure off. And then the spinal cord sends the information back to the muscle and tells it to relax. So it's a way to improve range of motion, flexibility, your optimization of the way your muscles react when you run. It improves all of that in a very gentle, safe way. So we're going to do some of that right now. I'm going to move this little screen over so I can see our clock, because we're going to do each one for 90 seconds. And so we're going to start with the plantar fasciitis, anything for plantar fascia. So what you can do is use a pillow to prop yourself up on a couch. And then you're going to take the hand and you're going to hook underneath the heel. And you're going to hook the other hand on the front of the foot. And we're going to shorten this plantar fascia. So everything here needs to be very relaxed, and then you're going to just shorten it. So see how I'm going to doing this to it. So I'm going to hold that, and now I'm going to hold it for a minute and a half. So it'll be a bit of a long video, but this way you can go right to it with me. And I'm shortening the plantar fascia, and then you hold it very, very still, and your leg muscles stay very relaxed. And again, the way it works is there's a little reflex loop of the nervous system going from the muscle or the tendons to the ligaments to the spinal cord, and then back to the muscle that tells it all to relax. And we have another 40 seconds to go. So we're going to go through all of them so that you can just follow along and use this each day as you like. There'll be a whole bunch of them on here, and you can do a few of them each day, or you can go through the whole thing once a week or a few times a week. It's a way to get some self-treatment for yourself, even when you can't come in to see me in person. So we got another 30 seconds. So we're making it a long video so that you could follow along. You know, we could have made it short, but then you would have had to stop the video at each section. So there's a minute and a half. So that's been shortened. That's going to feel much more relaxed. And then we'll do the other side. So the key is to be very relaxed with your leg. So this is all relaxed. I'm going to take my hand and I'm going to grasp the heel and take the front of the foot, and we're going to push them together. So just like this. And we're going to hold that for a minute and a half. This is for plantar fascia stuff. And even if you don't have plantar fasciitis, it's going to be good to do. It's going to help to balance the whole leg. Once you do this and then walk around afterwards, you can notice what you notice that's different. And if you do it, say, the night before a run or night before a race, then you can see how you feel during the race, and it'll sell you on the idea of like, oh yeah, this is worth doing. The tough part about it is it just takes a little time. So there's a minute or so. We're going to keep on going. Another 10 seconds. And the reason it takes a little time, the nervous system needs time to reset a bunch of little receptors. So there's a minute and a half. Now for the Achilles, the way we do it is we take this Achilles, so here you have the calf muscle, right before it turns into the muscle, there's the Achilles, and right before it turns into the bone, there's the Achilles. And what I'm going to do is push in and then push them together. So I'm going to push in and push them together. Not too hard, but just push in and push them together, and then we hold that for a minute and a half. And so you can see we're shortening the Achilles tendon. So if you have Achilles tendon problems or you just want to optimize the whole foot and leg, this will reset that whole posterior chain. We've got the bottom of the foot that we just did, and now we're going to do the Achilles. And it's just as simple as push in and then bring it close together. It shortens the Achilles. We're coming up on a minute, so we got another 30 seconds to go. We're starting you guys off with some of the easier ones. There'll be some that are a little more intricate, but still very doable. So there's a minute and a half. Now relax, and we'll do the other side. We've got the right leg, and here's the Achilles from just right here to right here. I'm going to press in and then bring them together. Press in and then push them together. And you can tell I'm not pushing very hard. You can also hopefully see that the leg is really relaxed. So you want to have the leg muscle relaxed because everything needs to be turned down. All the little nerves have to be put in a position that helps them all relax. So now we'll do a minute and a half. Got about a minute to go. Another 15 seconds. You can see how I'm keeping my fingers very still. Once they put the pressure in and then bring them together, I keep that very still. We don't want to move it around because we want the nerves to kind of relax. Okay, so there's a minute and a half. Okay, the next one is for the gastroc. So with the same side. So this is for the calf muscle. And what you do is you put your leg at 90 degrees. So my knee is at 90 degrees. This is all relaxed right here. I'm going to take my lower leg and I'm going to turn it in and with a bit of pressure. So that's going to turn in. I'm going to take my foot and I'm going to invert it, which means I'm going to tilt it like this. And then once I tilt it like that, I'm going to push my heel up towards my knee. So to review, the lower leg turns, the foot twists as if you're spraining your ankle, and then your hand pushes your heel bone up towards your knee, and you hold those 3 forces for 1.5 minutes. So it's getting a little more complicated, but still totally doable. The lower leg is turned in, the foot is in a position as if it's spraining, that sprained position, and then the hand is pushing the heel up towards the knee. And we go for 1.5 minutes. And some of you might feel like there's movement happening in your leg. Other people might not feel that, but you resist any kind of urge to move your hands. But you might feel your leg actually moving on the inside. And that's your body unwinding stuff and fixing things up. We're going to go another minute. It's nice to have a clock to look at so that you can get it just so. If you held it longer than 1.5 minutes, it would actually be a bigger body effect. You can experiment around and do these for more than 1 minute, and more than 1.5 minutes, 2 minutes, 3 minutes for each position, and the whole body unravels and does some good things. So there's 1.5 minutes. I'll relax there. And when you relax nice and gentle. No jerking, quick movements. So here's the left one for the calf. This is 90 degrees. You're going to take the lower leg and turn it in. I'm going to take the ankle and move it like this, as if you're spraining the ankle. And I'm going to push the heel bone up towards the knee. And then we hold that for 1.5 minutes. This works way better than stretching. If you're stretching, like they say stretch out your Achilles and stretch out your hamstrings and your quads. If you're stretching, you're sending the nerve impulse from the muscle to the spinal cord, and the spinal cord reads it and says, oh my goodness, things are being stretched. And so what it does, in its wisdom, it sends the impulse back to the muscle and you get a contraction. And you see it really easily in the little patellar tap. When the practitioner taps the patellar ligament or tendon in the knee, and then the knee kicks out. So what you did was you stretched it with the little quick stretch with the reflex hammer, but the result you got was a contraction. So instead of getting a stretch, you got a contraction. So this reflex, it's called the reflex arc, doesn't go away. So when you stretch, this is firing and telling that muscle to contract. So when you're stretching, you're kind of fighting against a muscle that's contracting, and you can tear it. So this works in another way to work with the body to help it relax. I find it much more useful than regular stretching. We go another minute, I think. I think we go another minute. It's easy to lose track of the time on the clock. But I believe we have 1 more minute. Another 30 seconds. So there's a minute and a half coming up right about now. So I relax it very easily. Now this next one I'm going to show you is really cool. And I do want you to test a little bit before and after. So just kind of swing your arms and see if one arm's a little tighter than the other one. And we'll use the one that's a little tighter to start with. And you go ahead and relax your arm on a pillow because you don't want to use any muscles. Now for your right arm, we're going to twist it like this. So I'm going to take this thumb and I'm going to twist it like this. So hopefully that makes sense. Here it is. I'm going to hang on to it. I'm going to twist it like this. So here it is. The thumb is right there, kind of in a very relaxed position, a natural, like you're holding something position. I've got a lot of relaxation happening here, and I'm going to take this thumb and I'm going to twist it. So I'm going to go ahead and twist it just a little bit, and I'm going to hold that twisted position for the minute and a half. And we'll see what it does to your arm in just a minute. Because with running, you want to make sure your arms swing very easily too. And you want to keep everything very relaxed. And the only thing that's working is the hand that's twisting the thumb. Everything else is in a very relaxed position. Okay, we'll go a little bit more, another 30 seconds. Okay, that's a minute and a half. And now, check it out. Swing your arm and see if that arm is a little looser somehow. Isn't that cool? So now we do the left arm. And so I'm very relaxed here. It's in that relaxed position as if you're holding something. And I'm going to take this thumb, the left thumb, and I'm going to turn it this way. So I'm going to just grab it and turn it this way. So here it goes. Hand is relaxed, and I'm twisting it. And we're going to go for a minute and a half. The thumb is, of course, a very important structure. And so in the brain, it's mapped with a lot of surface area, which means the brain uses a lot of neurons up there to control the thumb. And so when you do this strain counter strain for the thumb, you affect a lot of brain area, and that is why the whole arm can loosen up. There's other ones for muscles in and around the shoulder joint that we use, and the ribs that are used for runners, but it's a technique that you can't do to yourself. It's like, the position makes it where you have to have somebody do it to you. But I'm giving you a whole bunch here that you can do for yourself. You know, use it the night before races, the night before runs. Got about 25 more seconds. Okay, there's a minute and a half, and then relax, and then test it out. See if your arms feel a little looser. Isn't that cool? Okay, the next one is interesting. They're to release things around the right rib cage, specifically the liver. And then we're going to do the one for the stomach. So it's to relax this part of your body. When you run, it's important that you have a lot of good motion through there. We're going to combine it with something called relax, relief, release. It's also called Logan Basic. It's an old chiropractic technique, and it uses very, very, very light touch. So if you were to touch your skin in a way that, say you were going to touch a butterfly, and you wouldn't want to hurt the butterfly. That very, very light touch. So you're touching so light that if you touched any less, you wouldn't be touching. So I'm going to guide you through one thing to do before we do the liver and the stomach to give you this technique. It's also a very good technique as a standalone thing. You got the neck, and then the first bone you feel is the top of your breastbone. It's called your manubrium. So you come down till you feel that first bone, and we're going to touch the bone, and we're going to push it up a little bit. But we're going to do it, again, very lightly, as if you're touching a butterfly. And you're going to take your finger and your middle finger, your thumb and middle finger, and you're going to flip it and go right behind your head. So you've got your head, but below the head is the very first part of the neck. So I go from the head, and then just barely below below the head, on both sides, we're just going to very lightly touch it, and we're also going to push that up towards the ceiling. So very lightly, and we'll hold this one for a minute just to give you a sense of what it does. This is a foundation technique, meaning that it's one that we use in many different ways, and it works on ligaments and connective tissue. It helps in a meditative state. It can relax you. So you might be feeling a little more relaxed when you do it. And we use it with a lot of different drills. This one's less important to do at a specific amount of time, but to keep things consistent, we'll go a minute and a half. It's relaxing me. We'll come back to this one and use it in another way in a little bit. And so now, just swing and see if you're getting a little looser. You can even walk around a little bit, pause the video and see how you feel. Now, this next one is for the liver and the stomach, and this center section. And we're going to combine it with this really light touch. So if you go down your breastbone, you're going to come to a little divot, a kind of little indentation. And you can just put your fingers right at that little divot, just like that. And then you've got your ribs, of course, and you can just touch along the ribs. So I've got the little divot, and then I've got just around the ribs. And we touch very, very lightly, like you're touching a butterfly. And now, for the liver, we're going to slouch, and then turn the body to the right about 30 degrees, and then tilt the left shoulder down about 35 degrees. So just estimate, it's like this. We slouch, we turn to the right 30 degrees, and then we bend to the left about 35 degrees, and then we hold that. This one's technically 1 minute, but we can do a minute and a half again to keep it consistent. So we'll go 1 minute and a half. And again, you hold things really still. Just relax as best you can. Okay, and now remember we've got the same spot, the little divot is right there, and I've got my fingers around the rib cage, and I'm just touching very, very lightly. And we're going to do the stomach side. It's a little different. It's still slouch. Go a little bit farther if you can, 35 degrees, and then this time tilt a little bit less, 15 degrees, and hold that for 1.5 minutes. It'll be really fun to see how you feel after this, and how you feel walking and how you feel running the next time you run. These make a lot of nice changes in the body. About 45 more seconds. Okay, the next one we're going to do is we're going to come back to this little technique. And we can do this in different ways. We'll do it with a couple different spots. Another of those spots is the belly button. So you can touch the belly button. You can touch, not the neck, but the first bone of your sternum, your breastbone. And touch, and then push them both up. And this one we're going to turn to the right a little bit. And then stay there. And then turn your eyes back to the left, like look left. And then relax your eyes and just turn a little bit more to the right. And then with your eyes, look left. And then relax your eyes and then turn a little bit more. And with your eyes, look left. And this gets a lot of different joints in the body to relax. And then come back to the middle. We're going to turn to the left, and then, but not too far. And then turn your eyes to the right. You're just touching the belly button and the top of the sternum very lightly. And then relax your eyes, turn a little more to the left, and then turn your eyes to the right. And then relax your eyes, turn a little more, and your eyes to the right. And then relax. And this does a lot of wonderful things to your body. Okay, the next ones I'm going to show you are for the ankles. It's a little more involved, but you can do it. So we'll start with the left ankle. So here's the left ankle. And what we're going to do is put the foot on the side here, and I'm going to put my fingers not on the little bump, but a little below the little bump. Both fingers like that. And then the other side, I'm going to put them on the bump. So you've got the bump, the malleoli with the thumbs, and you've got the fingers just below the little bump. So right here, and then right here. And then I'm going to press the fingers together so you can tell I'm kind of pushing, I'm kind of shearing them. The upper bones are going towards the floor, and the lower bones are going towards the ceiling. So we're going to go like this. Of course, we get a little pillow for support. I'm going to take my fingers, and I'll show you like this. I'm going to go on this bone, on the bump. And on the other side, I'm going to go not on the bump, but a little bit south of the bump. So there's that. I'm going to put my fingers below it together. So I've got them below it. I've got the ones up here, the thumbs on top of it. And then I just squeeze my fingers. So it's like the top, the inside edge is going towards the floor, the bottom part is coming towards the ceiling, and then of course we hold it for a minute and a half. And these will make your feet feel very, very good. It's a beautiful day here in Fairhaven. We've got some big windows looking out over what's called the Village Green. And the little trail is right out the side of the door. Beyond Limits Physical Therapy. And I lost track of time a little bit. I think we have about 45 more seconds. Okay, so that, I believe that's a minute and a half. Now the next one, the left foot, we're going to go not on the bump, but a little bit below the bump, and I'm going to use this part of my hand just to push it straight down. So I'm going to put it over the edge a little bit, and I'm going to push straight down, not on the bump, but a little bit south of the bump. I'm going to push straight down like that, and hold that for a minute and a half. About 45 more seconds. Okay, now the next one's a little intricate. I'm going to be on the side here. I'm going to push the lower bone straight towards the floor, and then I'm going to take, let me see how to do this. Yeah, straight towards the floor, and then the foot is going to turn as if you're spraining it for the left one. So we're going to go push straight down, and I'm going to take the foot, and I'm going to twist it like this. And that's for the minute and a half. Another 10 seconds. Okay, the next one's a little intricate as well. I'm going to hook my fingers underneath the heel bone and I'm going to push it up. And at the same time, I'm going to put my thumb on the bump and push it down. So the bump goes down, the heel goes up. You can even take your foot up here. And then I'm going to take the foot and instead of twisting it like I'm going to sprain it, I'm going to twist it the other way. I'm going to twist it like that. And so I hold that. The heel bone goes towards the ceiling. The ankle bump on this inner edge goes towards the floor. And the foot doesn't twist like you're spraining it, it twists the other way. And we hold it for the 1.5 minutes. A little intricate, but gives a lot of good benefit. About 45 more seconds. About 20 seconds or so. Okay, 1.5 minutes there. Okay, and we'll do the other side. This will be a great video for you because you can watch it and just follow along every time. At some point you'll memorize them, but until then you don't have to memorize them, you just follow along. So the right one, we're going to push the, not the bump, but a little bit below the bump, we're going to push it straight down. So over the edge, and I'm just going to push straight down. And with this you're pushing with about a pound of pressure straight down towards the floor. We're going to go 1.5 minutes. I'm going to be making a really good blog post later today about a book that I've got that has the training that we talked about. That it's going to be awesome to get that dialed in. It's so neat that there's a running method that uses these same kind of principles of not force but working with the body. I believe there's another 15 seconds. We might go a little bit longer because I might have lost track of time. Okay, so that's 1.5 minutes. Now with this one, I'm going to push my thumbs on that bump, the inner bump, straight towards the floor. My fingers, let's see, I use my middle fingers, on each middle finger, and below the bump, I'm going to push it up. So below the bump, I push up. On the bump, on the inner side, I push down. You're basically squeezing them together, and then we hold it for a minute and a half. Another 25 seconds. Okay, there's a minute and a half. The next one, remember this one, we push on the heel bone that way, and then I twist my foot as if I'm spraining it. So push down, take the foot and twist it this way. A minute and a half. Another 15 seconds. Okay, and one more here before we move on. You're going to push the thumb into that inner bone down. I'm going to take the fingers on that heel and pull it up. So thumb pushes the bone down, fingers pull the heel bone up. I'm going to take the foot, and instead of spraining it, I'm going to go the other direction. I'm going to go like this. A minute and a half. 20 more seconds. Okay, so that's the ankles. Now I'm going to show you another series of ankle things. Just it's 2 techniques for each foot, and it's very, very powerful. It's called Secret of the Talotibial Joint from Integrative Manual Therapy. And what you're going to do, here's the left foot, and so you got the little bump, and then you got just below the bump, and you're going to take your fingers and put one set of fingers on the upper bump, one set of fingers on the lower bump, and you're going to push them straight down like this. Let me see. I'm sorry. You're just on the front of it. You're in the front of the foot, and you're going to push them down towards the heel, so in towards me. So I'm going to take both hands right close to each other. The upper one is on the inner bump, and the below it, the left hand is on the outer bump, and then the other hand is just below it. And you push down a little bit towards the heel, so you push in a little bit, and then you take both hands and push them towards the couch. So interesting technique. You push it towards the heel bone, both hands, and you push both hands towards the couch. We'll hold it for 1.5 minutes. This one's not really a 1.5 minute technique, but we'll keep it consistent. It's a technique you could use for a little bit less or quite a bit more, and it loosens up the ankle in a wonderful, wonderful way. This is the last one I'm going to show you from these little techniques. So I'm pushing them both towards the heel, both hands towards the floor. Okay, the next one's a little intricate. On the inner part of the foot, there's a little bump. It's called your navicular bone. And what we're going to do is put one finger, your middle finger, on your navicular bone, the other one just north of it. So navicular bone, little bump. The other one is on the talus, and you're going to push them in, and then you're going to push your fingers apart. So you're going to like push in and push apart. So I'm going to find that little bump, and I'm going to find the other. Let's see, how do I do this? There's a little bump. There's the one just above it, and I'm going to push them down and push them apart. And I'm going to take the heel and I'm going to pull it towards me. So a kind of intricate technique. So I'm pushing the two fingers down towards the floor, and I'm separating the two fingers a little bit, and I'm taking the heel bone and I'm pulling it towards me. And we'll hold that one for a bit. 1.5 minutes is good. Wonderful, wonderful technique. It's called the Secret of the Talotibial Joint. This is our last one. We'll do the other foot. And then what you can do is walk around, see how you feel, see how the next run feels. Use this a little bit. You can use the whole video once or twice a week if you like. You can just do 5 or 10 minutes of the video and then pick up where you left off and do a little bit every day. We like to do a whole bunch of work on my son about 3 or 4 times a week, maybe 5 times a week even. We have the luxury of me being able to do that to him. This is a series of techniques that you'll be able to do this, some of the techniques that we use on yourself. And you just take a little time and watch a video of some sort or a movie and listen to a podcast, whatever you want. Well, you can't listen to a podcast, but you'll get these in your hands where you memorize them, and then you can do them. Or you can just play the video over and over again for guidance. Okay, so there's that one. We'll do the other side and then we'll wrap it up and see how you guys feel, how you feel. So again, there's the big bump is the navicular. The next one up is the talus. I'm going to push my fingers down and I'm going to separate my fingers. I'm going to go like this. And I'm going to take actually we've got to do the other one first, don't we? So I'm going to go the 2 bumps, and then just below the 2 bumps, I'm going to push in and then push towards the floor. So the 2 bumps with my fingers of the top hand and my thumb of the top hand, and then just below that, I'm going to push in towards the heel and then down towards the floor and hold that for 1.5 minutes. This is the first part of the secret of the talotibial joint. We'll go about another minute on this one. Another 30 seconds or so. Okay, there's that. Now we're going to take the little bump, that's the navicular bone, and then we're going to take the other finger just a little bit above that, and I'm going to push down and separate them out, and I'm going to take the heel and pull it towards me. And we've got 1.5 more minutes to go. And with these, we push a little bit more than that really light touch technique. So with this, you'll have a way to work on the bottom of the foot, the plantar fascia, the Achilles tendon, the gastroc, which is the calf muscle, the hamstring, thumb, which helps the whole arm, the liver and the stomach, which helps that middle section of the rib cage, the lower rib cage. Some techniques for connective tissue, those little light touch ones. We'll have some for the whole body, those 300 technique ones where you touch a couple of the light touch ones and twist the body and move the eyes. And then the ankles, the 4 positions for each ankle, and then this secret of the talotibial joint for each ankle. And you can use some of them or all of them, or make it a routine that works for you and your schedule, and see how you feel the next time you go for a run after doing this. You could do it the night before and then go for a run, and over time see how it feels doing it 2 or 3 times a week, parts of it 2 or 3 times a week, or the whole thing 2 or 3 times a week, and see what it does to your running form. All right, so I'm going to sign off now and send this over. And Ralph Havens, Beyond Limits Physical Therapy in Bellingham in Fairhaven, Washington. Let's get out there and run.